Welcome to the Texas Conflict Coach radio program. If you've ever experienced or engaged in destructive or unresolved conflict, then you know it leads to broken relationships, distrust, and damaging results. Our program will help you manage and resolve conflict effectively with strategies, valuable resources, and support. Since 2009, our radio program hosted guest experts from around the globe sharing their perspectives, experiences, and expertise while giving you food for thought. If you can't listen live, then download and listen to any of our 300-plus podcasts in our library at texasconflictcoach.com. So sit back, relax, or join the conversation every Tuesday evening, or tweet us at TXConflictCoach.
There has been an increased emphasis on teamwork and collaboration in the delivery of health services over the past decade. Much of this has been due to research that indicates the need for good communication and coordination in order to provide safe and effective care to patients. For most health professionals, daily conflict can interrupt teamwork, can make communication difficult, creating risks for patients and diminishing morale for healthcare workers. With the implementation of healthcare reform and more people accessing health services, it's even more important that health professionals learn how to engage with patients and with one another in the midst of conflict. So what can be done to improve how conflict is managed in healthcare organizations? How can health professionals cultivate their own health conflict competence so that they can be better at addressing conflict in the clinical settings? What should patients know to expand the options for dealing with difficult situations that arise during the course of treatment? In discussing this growing area of conflict resolution, our guests will talk about what conflict looks like in clinical work settings, why conflict is so hard to address amongst healthcare professionals, and what is happening to improve conflict management within healthcare organizations. Hello, I'm Stephen Coates, your guest host, and joining me today for our program entitled Working Together, Not Just Side by Side, Cultivating Conflict Competence in Healthcare Organizations is Debra Gerardi. Debra is a healthcare conflict engagement specialist and consultant providing executive coaching, mediation, and facilitation services, conflict assessment, and professional development programs to healthcare organizations internationally. She is currently President and Chief Creative Officer for EHCCO, Emerging Healthcare Communities, a community of practice working to improve collaboration and conflict engagement among health professionals as means of shifting overall culture of healthcare. Debra works with executives, clinical professionals, senior leaders, policymakers, researchers, and organizational development professionals to support healthcare organizations that seek to innovate better approaches for delivering safe and effective patient care. The focus of her work is to remove barriers to collaboration, including ongoing conflict and miscommunication, so that health professionals can return to the work that they were called to do. Welcome to the show, Debra.
Thank you, Stephen. It's a pleasure to be with you.
Well, we're really glad to have you, and that's really fascinating work that you're in. How were you driven to this type of work? What brought you to it?
Well, I started out as a young kid always wanting to work in the hospital in healthcare, and so my first job working in an inner city emergency department was in 1979 when I was in college. And I worked as a unit clerk, checking in patients to the ER during the evening shift while I was going to school. And I really started to get a sense of, all of the dynamics that health professionals have to deal with on an ongoing basis as people come in for all kinds of care. I went on to be a nurse and worked in the ICU for many, many years. And during the time that I was working in the ICU, my first job, we had new policies put in place that changed how hospitals were paid by Medicare. And all of a sudden, like overnight, there was such a focus on cost containment and saving money, and that was really a new way of thinking for most healthcare organizations. It was such a shift in focus from just taking care of patients to actually managing the business side. And so, I became kind of frustrated and thought that, the system doesn't work really well if we don't have good policies in place, and that led me to go to law school and really think about health policy and how to improve healthcare from that standpoint. And it didn't take me long to realize that really what helps us deliver good care in healthcare is to have good relationships, to be able to work really well together as a team, to partner with patients. And so I really became interested in how do we improve that part? How do we get better at working with each other? And I went on to become a mediator, and I've been working with hospitals and physician groups and patient groups for about the last 12 years, just dealing with conflict and those places where we just don't get along with each other well or communicate well, and how can we do that better?
Well, it's a fascinating background because in some sense you've sort of seen almost all the angles. You've been there from sort of the wide-eyed, fresh employee to the seasoned healthcare provider to the legal expert, and now someone with a conflict background. What are some of the typical problems that most healthcare professionals face when working in a hospital setting? Because I'm imagining you've seen it from all those different perspectives.
Yeah. So, I would say across the board, the top things that health professionals struggle with is the really high production pressures, the pressure to see a lot of patients, in a day, and to take good care of everyone in a very complex system where they don't have good information, where there's a lot of regulation, where there's a lot of high stakes and high emotions on a day-to-day basis, where there's so much rapid change with new technology systems, building new hospitals, new technologies, new requirements to track data. There's just a lot of pressure that's put on health professionals, and they want to try and give good care. Most health professionals I know want to go in and do the stuff that they were called to do, which is to help people heal. And yet they have all of these systems issues surrounding them that makes it really hard. So it creates a lot of tension in the system. And on top of that, we're not really trained in how to deal with conflict. It's kind of expected you'll just figure it out when you get out into your practice. And so we're not trained in how to negotiate well, how to work as a team per se, and especially for those of us who have been around for a while, we're just starting to see new clinicians who are in school get some of that training. But for most of us, it was just kind of on-the-job training. And so I think with the increasing pressures and kind of the lack of ability to deal with some of the conflict and tensions that come up, that has really contributed to a lot of the conflict that health professionals have to deal with.
So it's not only the stress or the challenge of being in an environment that in most cases, or in many cases, is life or death. It's not only that, but it's all the other things on top of that of, as you were saying, cost issues and communication issues and all those other kind of things. And so with all that going on, why is it so important that we address these issues?
Well, conflict's not new in healthcare or any other setting, but, I was doing a little bit of research, and I found an article referring to conflict in the OR, and the article was written in 1900. So, conflict's been around for a while, obviously, in the healthcare settings. It's just a stressful environment. But what I think is new in the last, 5 to 8 years is the focus on patient safety. We started looking at what causes unsafe care, what contributes to bad outcomes with patients. And what we see is the number one contributor is if we are not communicating well and working as a team, then patients can be harmed. And so that has really been an emphasis on, put an emphasis on our ability to work better as teams, not just as a hierarchy and not just as individuals, but really to work interdependently. And that means even understanding what each other does, that if I go to nursing school and only learn about nursing and a physician goes to medical school and only learns about medicine, we really don't know what each other does. We just kind of have to figure that out when we get out there. And so having that appreciation for the different roles and contributions and being able to communicate across those different areas of expertise and to plan together and make decisions together on behalf of the patients, that can actually improve the quality of care. So that includes also being able to deal with our differences and our conflicts when they come up and developing some skills to do that well.
So yet again, it's another comprehensive outlook. where you're taking into account so many of the different factors that you mentioned before, but also seeing how if the team doesn't work well, in some sense, everybody suffers.
Yeah.
Is that safe to say?
Yeah, everybody suffers. And, of course, it's obvious that the patients are going to suffer if, we don't provide good care. But, the team suffers too. And so a lot of my practice these days as a coach and a mediator, the kinds of things that I see among health professionals is a lot of loss of resilience, a lot of burnout, moral distress, people feeling like maybe I need to just get out of the work completely. I don't know if I can do it anymore, all the way up to some depression and high rates of suicide among clinicians because it just feels overwhelming. And, if they're not healthy and feeling good about their work and feeling like they're working in a healthy work environment, they just can't provide the kind of care that we need for our patients and their families.
Mm-hmm. Because that would be the, I guess almost in some sense the secret sauce, is that figuring out what you can do to help doctors and nurses and all the administration staff, but even the physical plant folks, the folks who mop down the hallways, like getting them all in some sense on the same page sounds like part of your passion, but also what you think is one of those things that's a crucial factor in healthcare.
Yeah, absolutely. And, one of the unique things about healthcare, unlike, other industries like financial services or, law or other industries, is that healthcare is relationship-based work, that all of the work we do in the clinical setting is based on what we call the therapeutic relationship. And that means that we form a trusting, respectful relationship with the patients and families that we serve. And all clinicians are taught about that. We all understand the importance of a therapeutic relationship. And so the foundation of our work actually provides us with a foundation for how to work together. That if we take that relationship focus and we apply that to our work relationships with each other, we actually have a foundation for how to develop trust and respect and improve communication and manage our differences amongst each other. But we have to think about transferring what we already know to do with patients and families and using those same skills and abilities with each other.
So I'm sort of laughing because it just sounds like to me, or it just comes to me, it's literally physician heal thyself in some sense.
Yeah,
where you're taking the principles that are supposed to be applied to are applied to the patient, and basically turning the mirror right back on the physician and the whole team and saying, okay, we're going to play by these same rules. Is that fair?
Yeah, to just say, we have to treat each other with respect and trust and be able to engage with one another even if we have conflict, and not be afraid to move toward each other when things are going badly rather than turn into adversaries or withdraw from each other, which tends to be our pattern. That we tend to be nervous and, not know how to do it well, or afraid we're going to make things worse, or not want to, stir the pot and damage the relationships that we have with each other. So we tend to not address it at all, or if we address it, maybe we don't do it so well. And so there's just so many opportunities for just getting better at that. And I think there's a lot of effort now to do kind of conflict training and, provide some of these skills. But it's very superficial what's being provided. We really need to do it at a deeper level and look more particularly at how do I personally show up in relationships with other people. So am I trustworthy? Am I able to be aware of my own habits and hot buttons? What's my own sort of emotional intelligence and my ability to deal with conflict when it arises? Do I withdraw? Do I react? Do I retaliate? Do I try and get back at people? So if I have a better understanding of just my own ability to be in relationship with other people, that improves my capacity to engage and be a good partner with patients as well as with my colleagues.
Mm-hmm. I want to remind our listeners that they're listening to the Texas Conflict Coach Blog Talk radio program with your guest host, myself, Stephen Kotev. Today I'm joined by Debra Gerardi, and we're discussing working together and not just side by side, cultivating conflict competency in healthcare organizations. So as we start to understand this better, Debra, what makes it so difficult to resolve conflict in healthcare settings, and what's being done to develop this concept of conflict competency among healthcare professionals? And I think if I could give you that as two questions, sort of the first is what's conflict competency, and then the follow-up to that would be, what's being done.
Yeah. So when I think about conflict competence, it's more than just having good communication skills or, an ability to sit down and structure a conversation. Sometimes that's what people think that is. But it really involves my ability to sit down and self-assess, be self-aware of how well I work with and engage with other people. And that could be other people who are my peers, my boss, patients, the public. How do I show up when I come to work? And where do I need to get better at being in relationship to other people? So it may be that, I'm a really good clinician and I'm very technically skilled and I'm very efficient and I'm smart and I've worked my way up into a leadership position. But I might not have a good sense of my own emotional management, my own capacity to build consensus and collaboration with other people. It might be that I'm uncomfortable with emotions. I'm uncomfortable with conflict, and so I tend to ignore it. So those are habits and patterns that I have to be aware of. And then to have the mindset that says, if I can get better at this, I can actually do my job better and be happier in the work that I'm doing. So to intentionally move toward improving my abilities. That starts to form the foundation for what I would think of as conflict competence. In addition to my own ability to work with other people and develop myself around that, I have to look at the fact that I'm working in a complex system. That, hospitals and clinics are really complex places to be. And I don't have control over everything that happens, and that can be very frustrating for clinicians. We like to have control over everything. And if I don't have that kind of control, then it can be very frustrating for me. In addition, in these complex systems, a lot of things just don't work very well, so I may not be able to find a cart to wheel my patient down to the OR, and so I have to waste time trying to find that. And it might be that happens over and over again. So there's a lot of frustrations of the system not working really well. And so in those complex systems, I have to figure out how can I be my best? How can I work with others and not just independently and react to that stress, but find ways to not only work within that system, but also develop my own resilience and my ability to stay engaged over the long haul. As you think about the way of how we develop that conflict competence, and what's being done to do that, I think there is a bigger emphasis now, especially within health sciences schools, within medical schools and pharmacy and nursing and social work, to have us train together to do interprofessional education where we learn early on how to work as a team, where we learn early on what other people contribute to that team within their roles. And that's fairly new. We're just now starting to do that. And that's kind of the thing of working together and not just side by side, that we really do understand what each other contributes. And to develop our communication skills and more of the human skills, not just the technical skills, that we've focused so much on training ourselves to know the right drugs to give or the right procedure or how to work the equipment, how to move people through the system, things that are very technical. But the human side of our work is really has not gotten as much development over the years. And I think we're getting back to focusing on that quite a bit more in a lot of the schools.
Mm-hmm. Because it's almost like a push-pull kind of thing where you have to have that level of technical excellence, but in the same sense, that can only take you so far. and that if you don't have the team integrated, none of that expertise is going to make it anywhere, or it's going to get lost, or it's not going to be properly implemented. So it's great, as somebody who's listening in, from that perspective of just a general member of the public. It's great to hear that, because I think it's pretty easy to have folks point fingers and to just lay blame. So it's kind of nice to see that there's folks like yourself who are embracing that desire to be more proactive.
Yeah, and there's so many newspaper articles and TV news is always talking about the things that go wrong and the bad things that happen, and there is a lot of that we're trying to get better at and reduce the number of adverse events or bad events and get better at that. But there are millions of encounters every day where clinicians just do a really good job, and they're very caring, and patients get better, and people are cured. And, so there's a lot of good work being done out there. But I know that, it's easy to come in very distrustful of the healthcare system, because so many things can fall through the cracks, and so many folks have a story of, well, this is what happened to my mom, and this is what happened to, my neighbor. And so we all have kind of a story of things having gone wrong. But a lot goes right, too, and, really trying to balance that, I think, is important.
Mm-hmm. Well, and I think that's, so the next question that I have is that if you're a patient and you encounter some sort of conflict during the course of care, that's happening within that team, or, what do you, and you can adjust this question as is most appropriate, but, if I'm the patient, what do I do? What advice do you have?
Yeah, I mean, you're the patient trying to get better, and you just imagine if your team's fighting or, not communicating.
Right, yeah.
Well, that's frightening. And you already have enough to do to just focus on healing and getting better. And, so one of the things that I think is that, as patients learn to partner with health professionals, and I think there's a little bit of a generational shift in this, that for younger folks, it's just natural that you would make decisions together with your physician or with the, with the nurse or with the team. But I think for a lot of older patients, there's still that mystique of you do what the doctor says and don't ask any questions. And I know my mom fell into that category of, don't ask questions, don't make them mad, they know what they're doing kind of a thing. So I think we're in a big transition where we're really trying to move toward becoming better partners with patients, and patients are more informed. They have a lot more access to information than we ever had in the past. So, my advice to a patient would be realizing that health professionals are in these chaotic, stressful, overproduced environments, and that there's just a lot of stress on them, that appreciate that they may not see you as the whole person you are. They're seeing you as kind of the work that has to be done. And you can wake them up in that moment by trying to create a connection with that provider. And it can be momentary, holding hands, asking a question, just making that connection with health provider that reminds them, here's another human being, and this is what I came here to do. And the appreciation of, thank you for the work that you're doing, and thank you for the time you took with me or the time you took to make a phone call on my behalf. That I think a lot of times there's just not as much appreciation that happens. And I'll tell you from the inside, health professionals love having someone acknowledge and appreciate and recognize the hard work that they're doing. And so, as a patient, if there's an opportunity to create that human connection and remind them of what they're there to do, that really can interrupt some of the miscommunication and recenter people, refocus them back on what matters. I think the other thing is, if you have someone with you, especially if you're really sick, having an advocate or a family member with you who can also help create that connection and do some of that communicating on your behalf when you're too sick to do it yourself, that can be another way to kind of interrupt the pattern.
Because it's interesting, it's the same theme. It's just manifested in a different way. The the talk of conflict competency and having teams come together side by side is all about connection. It's first, it's connection to yourself, what's going on with my own emotions, how am I responding, how do I show up, and then how am I doing as a team? How do I understand what the oncologist does? Do I understand what the intake person does? Well, who's got to clean this mess up? Do I understand what that's about, or do I have some sensitivity to it? But now it's like coming full circle again and saying, as the patient, show, reaffirm, reconnect that humanity. Hey, this is a grandmother or a grandfather, and do that and be, I guess, generous. Say thank you and those kind of things, and have an advocate who can also foster that connection. That seems to be a consistent theme throughout everything you've said.
Yeah, I think that's exactly right. And the idea that that we connect through a sense of compassion for ourselves and for the people that we're working with and for the patients that we're providing care for, that foundation of compassion, that really can inform all of our decisions, all of our behaviors. And so staying connected to that piece can also help us with our own resilience so that we can continue to do the work and go into those environments on a day-to-day basis. And that requires taking some time for yourself, taking some time out, to take a break, go for a walk, eat, go and have lunch, and find ways to connect and be compassionate with those that are closest to you in your units, in your departments. So just those little bits of reinstilling a sense of compassion towards self and others, that's really the foundation. From that, we're able to deal with conflict and differences when they arise because we have that foundation of trust and compassion.
Well, how do they manage that? Because what I always see is that there's this expectation. Well, and I'm thinking more for like a surgeon or some sort of, trauma person, but, it doesn't matter what the profession or what part of the profession, that feeling of you're going to save the day. And, what do you mean take a walk? Like, I could be saving someone's life right now. How do you manage that? Because it seems like this terrible sacrifice of, I'm not taking care of them, or, what would you say to somebody who was saying, I can't, there's someone else I have to save?
Yeah. And, that happens a lot when I'm coaching physicians and others of, I just don't have time. I don't have time to take a break and go have lunch and do these things. And if we back up a little bit and really look at when you are your best self, when you are performing at your peak, what have you been doing that enables you to do that? And it's usually I've had food, I've had enough sleep, I feel prepared, I have a good team around me. So we know what works. And we often get stuck in this trance of productivity and this trance of efficiency. And so the question is, can I step back and actually make choices rather than be caught in this trance or this habit or this pattern, and say, so where in my schedule, where in my day can I be intentional at preparing myself to do the best job? Because I'm really not saving lives and serving people well if I haven't taken care of myself first. So the idea that I can back up and say, well, actually I could maybe make better decisions around my schedule. I could make better decisions around how many clinic hours that I schedule. I could make better decisions about how many committees or things that I take on. I can make better decisions around how much on-call time that I sign up for or overtime at other hospitals. Many nurses work multiple jobs. So the idea that I can step back a little bit and say, let me choose the schedule I want. Let me choose opportunities for embedding self-care and get out of the habit of just saying I'm too busy. And once people start to do that, they're just rejuvenated. That I do see surgeons and administrators and others who, once they start to get some of that balance back, actually are more productive and more efficient, just like they wanted to be, because they've been taking some time out for themselves.
Mm-hmm. So as we bring the show to a close, what would be your assignment for the week for our listeners?
Yeah. So I think the thing that really goes the farthest is to just sort of do a noticing exercise for the next couple of weeks and see what are your habits. What are the things that you just do habitually or your default mode, especially when you're in the face of conflict, and what could shift for you so that you could engage from a more compassionate or connected place.
Okay, which is very much the in a sense, the homework that you would give for our listeners sounds like the homework you would give for the highest powered, physician to to any other member of the team. It's just that same focus on self-awareness.
Yeah, because, being self-aware is self-correcting. So if I don't know it, I can't fix it. So if I can see the pattern, I can do something about it.
That's fantastic advice. So thank you so much for being on the show. How can folks get a hold of you if they want to, engage with you further?
Yeah, so the best phone number for me is 650-712-1240, and you can also reach me by email at debra@ehcco.com.
And so that also means you've got a website, which I'm guessing is
www.ehcco.com.
Right, and that's another way for anyone who's listening and to find you. So, final thoughts. Anything else you want to leave as for our listeners today?
Well, I just want to thank you, Stephen, for the opportunity and really appreciate the Texas Conflict Coach's focus on healthcare and conflict for this month. It's really an important area, especially as we navigate new reforms in the healthcare industry. So thank you for that.
Well, it's our pleasure, and we hope folks enjoyed today, and we'll listen in next time.
Thank you for listening to the Texas Conflict Coach. We hope you've enjoyed the program. You can find over 300 podcasts archived to listen at your own convenience at texasconflictcoach.com or download the podcast at iTunes or Stitcher Radio. To learn about upcoming radio programs and resources, sign up for our monthly e-newsletter.